Thank you very much, Louise, and thank you all for coming. It's great. It is great to see so many here, as the other speakers have already said. While I'm talking mainly about conscience protection in the healthcare, because that's the area that I'm involved in, it does pertain to other areas of life. So even if you're not involved in healthcare or a student in that area, it doesn't mean that hopefully, it doesn't mean that at least some of the principles won't be for you. So hopefully everybody will at least gain something from some of the ideas I'm going to put forward to you. It will be illustrated with a number of real life examples, most of them from my own life, some from other stories that I've come across firsthand from other people. So I think that might be helpful to see where we are on this issue. Start with a little bit of culture, if you don't mind. In 2017, there was a film released in this country, directed by Martin Scorsese, who some of you probably know for some of his other works. The film was called Silence, and it was based on an earlier novel by a Japanese Catholic, actually. There are not too many of them, but a Japanese Catholic from the early 60s, from the mid-60s, called Endo. It deals with the issue of conscience. It deals with the issue of religious persecution. At the time, it was set in around the area around Nagasaki in Japan, at the time in the early 17th century, when the Japanese authorities in the various different states were getting alarmed at the influence that Christianity was having on the people, that more and more people were turning away from the traditional pagan faiths of the Japanese past and converting to Christianity. And they felt they had to do something about this. And they found that the best way was to try and enforce apostasy, so that people who had become Christians, that they would renounce their faith. The little stones, or the graphic you see at the top on the left-hand side, they're called fumie. And they're illustrations of gospel pictures. So the magistrates and the authorities in Japan certainly knew their Bible. They were able to pick out these and get them carved, either in stone or in wood. And if a person was accused of being a Christian in a local village or a small town, they had to have a public trial, and they had to either announce publicly that they renounced their Christianity, or they would suffer terrible persecution, usually involving death, but usually death by torture beforehand. It was a simple sort of a stepping stone procedure. They had to step on the stones, and that was taken as a sign that they were no longer a Christian, or that they were renouncing their Christianity. Sometimes that wasn't enough, especially if priests or religious persons were captured. It felt that wasn't enough punishment for them, so they had to usually use swear words and about the Virgin Mary or Jesus Christ, and maybe spit on the stones as well as stepping on them. But it was all part of the religious persecution to try and make people conform to the ideology of the state. Of course, this isn't the only example in history of conscience being under threat from authorities. If you go to the Bible itself in the Old Testament, where in many occasions where the Jewish nation was enslaved by foreigners, either invaders or taken away into exile. And one of the most famous and heroic accounts from Maccabees second is the story of the 7 brothers who one by one were tortured for their faith because they would not succumb to the emperor's demand, Antiochus, that they would eat pork, because that would have been a sign that they were rejecting their Jewish traditions and Jewish faith and becoming pagan, following the pagan traditions. Of course, even since then, throughout history, I'm afraid, there have been lots of cases of people's conscience being infringed upon by state authorities, and people being forced into, well, you can't force people to believe something, but at least you can force them to act in a way as if they disbelieve or believe something. And throughout the period of the Reformation, a lot of Catholics in this country were cruelly treated, tortured. Catholics got their own back, I'm afraid, over a short period of time when Queen Mary was queen for a short period in the 1550s. So Catholics aren't immune from torturing, and of course there have been forced conversions of Jews and Muslims in various European countries. I think it's fair to say that Christians have probably suffered or are suffering more than Are we stuck? Many of you will be familiar with this tragic and horrific scene of 21 Coptic Christians on the beach in Libya. And there was a film made recently, because this was the 10th anniversary of that horrific event, where 21 Christians were beheaded by members of the the ISIS group, because they wouldn't renounce their Christianity and convert to Islam. And we heard just 2 days ago, 70 Christians beheaded in a church in the Democratic Republic of Congo, again by Islamist forces. So certainly there is still ongoing persecution, but people are brave enough, they will not renounce their faith. So in history and nowadays, many of these issues are religion related. So in the past, the issues of abortion, euthanasia, which were possibly tied up with religion and religious beliefs, but they weren't the key issues where people were on the front line trying to defend the pro-life stance in relation to abortion, euthanasia, sex reassignment issues, IVF, contraception, which we will deal with in some of those issues in some of the cases that I'm going to talk about in relation to healthcare. So nowadays, while we still have religious persecution going on and people's conscience being persecuted because of their religious stance, a lot of it, particularly in the Western world and in this country in particular, in North America, maybe to a lesser extent during this current regime, and Ireland in recent years, a lot of the conscience issues are related to people working in healthcare. I thought we'd start by just looking at what is conscience? Because it's not something tangible, it's not something you can take up and hold and look at and draw a picture of. So it's a concept in a way, something abstract. And I just picked a few definitions just from the internet. I like the first one actually, I think it's pretty good. It's a person's moral sense of what's right and what's wrong, viewed as acting as a guide to one's behaviour. So it does have an influence on our behaviour. It's not just a belief, it's something that leads to certain types of behaviour from a moral or an immoral point of view. Second one is not too far from it. I think this one was from Wikipedia. It's a cognitive process, so something in the mind, in the brain, that guides a moral judgment and action. So similar to the first one, based on individual. So we form our conscience based on values and beliefs and our education, I suppose. I'm not sure about this one. The part of you that judges your moral actions and makes you feel guilty. It doesn't necessarily have to make us feel guilty, because it can affirm us if we know we're doing something right. So you don't always have to feel guilty. But I can see what the writer of that definition had in mind, that it should be something pricking you. If you know you're doing something wrong, there should be something trying to tell you, whether it's your guardian angel or something else that makes you know that this is not right. The last one is from, you can't have a talk on conscience without mentioning Thomas Aquinas. So Thomas Aquinas considered it for those certainly of a religious persuasion, philosophical background, that it's reason, but a right reason, conformed to church teaching or conformed to the truth, which in Thomas Aquinas and for many of us here would be related to church teaching. So, but you have to have a concept of God and natural law to be able to maybe appreciate Thomas Aquinas. So I think for the first one, it's a moral sense of what's right and what's wrong. It tells us how to act according to what we believe to be right and wrong. I think is a good starting point. If someone asks you, well, what do you mean by conscience? However, these are not my thoughts, by the way. This is not everybody would agree with our stance in this area. There are some people who feel that, especially in healthcare, that there is no room for conscience. One of the most outspoken persons in this area is a guy called Julian Savulescu, who I don't think he's a professor in Oxford at the moment. He's a professor of philosophy and bioethics, and he certainly was a chair of that department in Oxford at some time, but he's got lots of professorships around the world. He's Australian originally, but he spent a lot of his time in the UK. He was the editor for many years of the British Journal the Journal of Medical Ethics, which is a very influential journal in this area. And his opinion was that he was talking particularly about conscientious objection. Now, I deliberately tried to avoid that term because it has negative connotations. So I talk about more of conscience protection. But by conscience objection, it means that you're objecting to something that someone is trying to make you do. So it is a valid statement. So he's talking specifically about conscientious objection, particularly in certain areas of healthcare. And obviously abortion was the main issue in his mind at this time, although he is very much in favour of euthanasia from a utilitarian point of view, that if you're not useful to society, then you really don't have any part in this world to play. But although uses can be, you could have an emotional use for some people. So he would see that, elderly people, just because they're not able to be a taxpayer, that they still might have a value because they might give emotional comfort to grandchildren and children and so on. But he feels that, as do many of his followers, that if you're not performing a useful function in society, then really you have no place here. So he's very much in favour of a euthanasia approach. So he feels that it's wrong and immoral to have a conscientious stand, per se, to object to certain things which are allowed by law. He feels it should be illegal, that there should be no rights whatsoever for someone to do something that they don't want to do, but you want to make them do it. And he says in modern healthcare it has little or no role to play. And in his mind, the law is what's key. So if the law banned abortion, he'd say, fine, that's fine. We can't have abortion. If the law bans euthanasia, fine. We can talk about it and try to promote it, but we can't expect people to do it. But if it's allowed by law, and I know Alex Schattenberg is here somewhere, he'll be, I think, probably talking about this issue in relation to Canada, his own native country. The poor doctors in Canada, I think they're probably going through a rough time at the moment, in that they have very little conscience protection, if any, if they have a stance on some of these moral life issues. And so his statement that he wrote in, this was in a BMJ article in 2006, that if people are not prepared to offer what's legally permitted, so whether it be abortion, euthanasia, gender reassignment surgery, then they should not be doctors, so they shouldn't be involved in medicine. Now, I can understand that to a point. And if, for example, if everything in medicine was pointed in that direction, then I'd say fine, then I wouldn't want to be a doctor if everything was going in that direction. For example, I wouldn't take a lucrative position working for Mary Stopes International, because while they claim they're providing a healthcare service, and they're always looking for medical people to work with them, and with very high salaries attached if people are prepared to do that. But it would involve something that goes totally against my principles and my actions. So I couldn't expect to sign up for Mary Stopes and then tell them, well, no, I'm not doing abortions. I'll do everything else, but I'm not doing that. So, but if, on the other hand, if the area of medicine you're working in, such as obstetrics, and I would encourage some of you, we badly need more pro-life obstetricians in this country. And again, I'll come back to that when I talk a little bit about a wonderful organisation called APLOG. But if the area of obstetrics involves looking after babies and mothers and women with gynecology problems that has nothing to do with abortion or any of these controversial areas, and 98 to 99% of the work is along those ethical lines, then it's very unfair to expect somebody who's trained in those areas to say, well, you must do the abortions, even though it only means maybe 1% or 1.5% of the actual job. Similarly, a Catholic shouldn't work in a brothel. To take an obvious example, if we're against prostitution and exploitation of women, we shouldn't be prepared to accept the salaries and to do the job. So I can understand Julian Savulescu's point of view that if you're not prepared to do the job, then you shouldn't be in the business. But it depends on how much of the job actually involves those type of immoral activities. If it's a tiny little percentage, then I think we have a good case to argue against that, especially for all the good that we can offer in all those other moral areas. I spoke to Peter from Glasgow earlier, who's a keen fan of Shakespeare and literature. This was a quote that Savulescu used in that article. It could be turned back on him because he was very selective. He just took the first two lines, and if he'd taken the whole context, it was actually Richard III trying to convince himself, because he was troubled by his conscience, that what he was doing, I've never read Richard III, so I don't know much about it. But what he was doing was wrong, so he was trying to convince himself, he was trying to basically murder his conscience by saying that conscience is but a word that cowards use. So it's a nice little quote, but if you'd taken the whole context, you actually could say, turn him back on him, well, he's the bad guy using that word, so then it must be, what he's saying must be wrong or immoral. And so, just to reiterate, I'll finish with Julian Savulescu at this stage. So the law was the determining factor. We all must obey the law, whatever that be. And the law is determined by the Parliament, who hopefully in most countries is determined by the people. And the just distribution of finite resources, which is reasonable because everything isn't available for everybody all the time. And then the doctor's value should have little or no role in making a decision about a patient's healthcare, for want of a better expression, that the patient's informed, so as long as they're making a reasonable choice, he feels that the doctor must respect what they want, even if it goes the doctor's values and religious principles or moral principles or conscience. So there are people in this world, and there's plenty of them in this country, who are not in favour of doctors exercising, or healthcare workers in general, exercising their conscience. This is not all bad news, by the way. I'm starting with the bad stuff first, and then we'll move on to the brighter side of the road. What's the BMA position? The BMA is a powerful organisation. It's the doctors' trade union, if you like, the British Medical Association. I'm not a member of the BMA. I'm not a member for two reasons. One, I think they're useless. I think they're very ineffective. And compared to when I was in Ireland, I trained mostly in Ireland, but I've been here 22 years. The Irish Medical Organisation was very powerful. The government could do nothing if the IMO didn't approve. So we had great power in Ireland, whereas the BMA can be walked all over by various governments if the governments want. Even though they had strikes and things last year. But more importantly, I'm opposed to them because of the stance that they've taken on areas such as abortion and end-of-life care. And they used to have a position of being in opposition to euthanasia and assisted suicide, but now they've moved to what they call a neutral position. And again, Alex might mention this, in Canada, one of the most important moves that the pro-euthanasia lobby need to do is they need to get the medical profession on board. They need, first of all, for them to turn away from their opposition to it. And if you can get them to a position of neutrality, you're more than halfway there to introducing euthanasia and assisted suicide into society. So the BMA hold this neutral position at the moment. They're highly in favour of abortion, and they're not too keen on the idea of doctors having conscience rights, although they have to be careful because a lot of their members are Muslims, Catholics, Christians of various denominations, who wouldn't necessarily support the BMA position on those areas. So they have to be careful that they don't offend too many people. But they certainly, if they make a statement, it will not be in favour of conscience protection. So who may need, certainly in healthcare, who may need conscience protection? Any offerings from whose conscience do we have to protect in relation to healthcare? I don't put anyone on the spot. But I think, I'm a doctor, so I think doctors, certainly at various stages in our careers, in our lives. Now, I'm a cardiologist, but I'm also a general medical physician, which actually was important in relation to the abortion reversal, because one of the accusations against me was that a cardiologist shouldn't be meddling in women's healthcare or whatever. But because I'm equally trained, if not more trained in general medicine, actually the abortion pill reversal treatment that we were offering is progesterone, and that's an endocrine drug basically, so it's endocrinology rather than obstetrics. I wasn't doing cesarean sections or delivering babies, I was helping women with a medical treatment. So that argument was more or less flushed out straight away. So I'm a general physician, so a lot of us enter medicine scared that we might be called upon to do something that we don't want to do. And that holds true for a lot of people who would love to do obstetrics, and I know several, particularly young women, who would love to be involved in obstetrics and care of women and their babies and mothers, and also women with other non-obstetric but gynecology needs, but they're just too afraid to do so because they know that they will be put through torment and persecution by some of their senior colleagues to try and force them to go against their conscience. So a lot of people deliberately avoid obstetrics, unfortunately. So I'm encouraging young people, because there's plenty of support out there. There are some people, and I will mention one or two, who have gone down that road. They've overcome the obstacles and the hurdles that have been put in their way, and they're standing strong and courageously, and gaining a lot of admirers as well, and inspiring others to do so. The bad news for people who think they can avoid ethical issues by going into areas that they really don't think, there's very, very few areas in medicine nowadays where you won't, or especially if this Ledbetter bill gets passed, because we all deal with patients towards the end of life. We all come across areas where we wonder, is it ethical to withdraw the treatment? So the patient is perhaps dying, maybe not dying, maybe there's a chance of recovery, and it can be sometimes difficult to determine, how close to death somebody is. And that's one of the objections that we have, by the way, against this Ledbetter bill, that it is not possible for a doctor to predict 6 months or 12 months or 9 months or 3 months in advance that somebody only has that length of time to live. We really don't know until the very, very final stages. And there are a lot of very experienced neurologists, anaesthetists, palliative care physicians, general physicians will vouch for that we get it wrong so often. You can toss a coin and say, I think that patient will be dead in the next 6 months. And you might be right and you might be wrong. You've got a 50-50 chance probably of, and it's the same whether you go on your intuition or your what you consider to be your experience and your learning. So there are very few areas in medicine where you're going to escape. You're going to have to deal with some of these issues. Maybe not abortion, although a cardiologist, I didn't think I'd ever be having to face the GMC over something to do with an abortion issue. And see, it's funny how the way things sometimes go in this world. Nurses need to be protected. Nurses possibly are at a more disadvantageous place than doctors. Doctors have a reasonable amount of protection because we've got, and again I'll come to it in a minute, we've got a little bit of protection in our General Medical Council guidelines. We're protected by law. Again, we'll look at the wording of the Abortion Act, which states very clearly that we're protected in many cases or in many situations by the actual law. So we have some good safeguards there to protect us. We've some very good legal teams that have taken a number of cases, especially in recent years, and won very successfully. Nurses are a bit more difficult. The Glasgow Midwives from 2014, 2015 went on for a couple of years. And while there was some recognition that nurses' conscience has to be protected, it didn't go the whole way. It said that nurses do not have to be forced to participate in abortions, but if they're in a supervisory or managerial role, then they cannot claim conscience protection in that situation. They have a duty to support other nurses who may want to do it and to rota them and so on. I know Connie Wood and Mary Dugan, who have strong associations with SPUC, weren't able to continue in the work that they had loved and trained for so many years as a result of that judgment. One, I suppose, positive thing that did come out of that was that the judge did recognise that the Glasgow Health Authority, who persecuted them and took the case against them, should have in some way respected their autonomy and their conscience and should have arranged reasonable accommodation. So that concept has come into law very much, and it's because it was a precedent at that time, and there's been a number of cases where that phrase is used, where if somebody has a genuine conscientious decision and someone's trying to put pressure on them, then the stronger of the parties, the health board, the health authority, must at least provide some. They can't just sack them because, you're not doing abortions, you're not providing contraception, we don't want you. So they can't just sack them. They must provide some form of reasonable accommodation to help them to continue in their careers and to support their livelihoods. Pharmacists need protection. Pharmacists, again, they don't have as much protection, I think, as doctors and maybe not even nurses. A number of years ago, and particularly it's in relation to the morning after pill or emergency contraception, where many pharmacists are very uncomfortable because they know that it can be abortifacient in some cases. The morning after pill is not just another form of contraception. It works, or it can work, in a number of three ways. In a number of ways, three in particular. It can prevent ovulation, so it can be a true contraceptive in that it can prevent conception occurring. However, it can also have an effect, a lethal effect, after conception has already occurred. So it can interfere with the movement of the embryo, the zygote, in the early embryonic stage, before implantation. And it can also interfere with implantation even after implantation has occurred. So it can work as an abortifacient, or at least kill an already existing very, very young human being. So a lot of pharmacists, and particularly I've had lots of conversations with some of my Muslim colleagues. It was mentioned at the start that I'm a former president of the Catholic Medical Association, and I've been involved with the CMA since 2008. And in 2014, the General Pharmacological Society, which is the pharmacist equivalent of the General Medical Council, they decided that they were going to do away once and for all with conscience protection in pharmacy. And they issued guidelines that people were to, it was a consultation, I suppose, that people were allowed to give their opinion, but it was basically decided beforehand what the outcome was going to be, but they went through the process of having a consultation. The CMA put forward a strong submission on behalf of the conscience rights of pharmacists. Surprisingly, they backed down. Now, it wasn't because, I don't think it was because of our submission, maybe it was written by one of my colleagues, Philip Howard, who was the president at the time, and very strong legal and medical background. So he wrote a very strong submission, but I think they backed down because, on the advice of their own legal representatives, they felt that they would be infringing upon the protection for certain characteristics. So there are some protected characteristics that have to be respected in law. And their legal representative told them that if you go ahead, because most of these pharmacists who were objecting to it, there were, I say, a lot of them were Muslim, some were Catholic, some were Christian, some for other reasons, not necessarily of religious background. But because most of the objections were from a religious nature, the legal representative or the legal expert for the General Pharmacological Society recommended that they should not impose it because they could be taken to court and they would probably lose because they were in breach of the Protection Act, protection of what's the protected characteristics, the age, sex, sexual orientation, ability or disability, and religion is still an important one of those. A lot of people don't like that religion is there. Somebody once called it the poor man at the table, but it's still there, so they have to respect it. So pharmacists, everybody working in healthcare can be put under can be considered to be complicit, particularly in abortion, and I'm sure if euthanasia or assisted suicide gets introduced into this country, it'll be the same, because you've got porters. Porters have to wheel the patient, so while they're not directly taking part in the procedure, they will, they're facilitating it, they're helping it. Cleaners, ward managers, other people working in offices, secretaries. There was a famous case, unfortunately, this is one of the cases where we lost. You could say we lost the Glasgow midwives case to some extent, from the conscience point of view, although there was a slight little spin on it that was on our side too. But overall, it wasn't a great outcome in that case. And similarly, there was an earlier case called the Janaway case from Salford, where a medical secretary was being asked to type a letter that had been dictated by, I think it was a GP practice, referring a woman for an abortion, and said no, she could not do that. She didn't want to be complicit in any way, and she felt she was within her conscience rights because the law seemed to state that nobody can be forced to participate in abortion. But the judgment against her went that she wasn't having a hands-on involvement in the procedure, so she had no right to refuse to type the letter. So there isn't great protection for some ancillary workers in the healthcare professions, although we would like that at least that should be recognised. What's the NHS position on abortion? I work in the NHS, and there's a lot of very, very good things about the NHS. It served this country very well in many ways since 1948, so for many years. But there is one dark shadow, I think, that will blight the NHS for eternity, and that is it stands on abortion. I put that's a. Has anyone ever looked at an abortion-related video on YouTube? If you put in, have you heard of Live Action? They do some great videos. SPUC probably do videos and lots of groups. If you put in if you type in abortion and you want to see something else, what is abortion? And that's what I picked up about what's a first trimester abortion. That lady is called Noreen Johnson. She's a former abortionist who converted and became a Christian. And she was married to, she's deceased now, she died a few years ago. She was married to another abortionist called Haywood Robinson. In fact, she taught Haywood how to do abortions, and then both of them realised the horror of what they were doing, and they both converted, became devout Christians, and became very much involved in the pro-life movement. So before she died, she did one of those videos for Live Action on describing exactly what happens in a first trimester abortion with the abortion pill. But I just a few days ago, I just typed in that, and that little blue square at the bottom, it's hard to read it, so I've typed it out in the wording. So it says abortion and abortion. So this is an NHS little key that comes in. If you put in a YouTube video, anything to do with abortion, and this doesn't happen with any other area of medicine, you can put in what is a heart bypass operation. No one's going to say a heart bypass. They're not going to have this little warning at the bottom of the screen or any other medical procedure. But for some reason, someone in the NHS decided, we have to inform the public what we believe abortion to be. So in the NHS words, an abortion is a way of ending a pregnancy. Anybody got any problems with that statement? It's true, it is a way of ending a pregnancy, but is it truthful? Is it fully honest? Does it explain exactly what abortion is? I don't think so. A caesarean section is a way of ending a pregnancy. An induction of labour and delivery at term is a way of ending a pregnancy. A miscarriage is a way of ending pregnancy. That is, strictly speaking, a spontaneous abortion, but it's not an induced abortion. So there's something very dishonest about that definition that I don't like. And if I'm sometimes involved in social media, I do a lot of things on Twitter, and I make comments about abortion and abortion pill reversal and other issues as well. I talk about football and films and music. But I get a lot of the conversations on people, and I'm astounded that people who are very strongly in favour of abortion, they will not accept that is not a complete definition. So if you ask someone who's pro-abortion, well, what is an abortion? It's a termination of pregnancy. It's ending a pregnancy. But they ignore some very, very important facets of what is involved and what makes it different from a caesarean section or a term labour or any other way of ending a pregnancy. Intent. So what is the intention in an abortion? The intention is to kill the child. And how is it done? Well, it's done by one of three methods, either by poisoning with abortion pills or by dismembering in some way, either by suctioning to a pulp through a small little vacuum suction tube, or using forceps and ripping the limbs in from them and then crushing the heads, because the head can't come out easily by itself if it's beyond a certain stage of gestation. Or thirdly, by killing the child if the child is already likely to survive birth. So if it's over 22, 23 weeks, and even less than that, they will introduce an additional element called feticide, where they inject into the fetal heart, usually potassium chloride or digoxin, some noxious or poisonous substance to stop the heart, and then deliver the baby, usually by an induction of labour. So these things are not described in the NHS website. It's looked on as just another medical procedure. It's a way of ending a pregnancy. So this is not truthful. As opposed to this. Some of you may realise I come from Ireland. Is Emmett here? Yes. Emmett is from Ireland too, I think. And there's one or two others from Ireland. The Irish are very, very careful with their words. They love words. They love talking. There's a saying that why use 10 when 100 10 words when 100 will do. Anyone who's looked at Mrs. Brown's Boys or Derry Girls or Young Offenders will know what I mean when it comes to precise meaning of words. Words are very important. In 2018 there was a referendum in Ireland. It got rid of what had been there before. This was the 1983 amendment to the Constitution to try and enshrine, first country in the world to enshrine in law the right of the preborn child to life, with equal regard to the life of the mother. So it was a wonderful moment in history, and it served to probably save thousands and thousands of Irish lives. Didn't save them all, because some women still go up to between 3,000 and 5,000 women a year went to England or the UK or sometimes further afield for abortions. But it almost certainly saved many, many lives that would otherwise have been lost. Because now, with the introduction of abortion in Ireland, more than 10,000 babies per year are being killed. But this is when the Eighth Amendment was overturned in 2018 by the referendum. So it was a democratic decision, although you would have to question some of the processes involved in the campaigns. They decided, first of all, the word abortion does not appear anywhere in the legislation. So this was the new legislation that they had to introduce into the Constitution to show that a change had come about. So they did not use the word abortion because of its emotive, the emotive consequences. They did not use abortion because it's open to misunderstanding and misinterpretation and people using it in the wrong context, which you get on social media all the time. Like trying to call, a miscarriage is an abortion, ectopic pregnancy is an abortion, all these things, but which aren't true at all. So the Irish lawyers and whatever officials drawing up this decided we must define exactly what is now allowed by law. And this I think this was actually quite good. I'm not in favour of it, but it actually, at least it's honest. So a termination of a pregnancy, they call it termination of pregnancy, but they don't just say it's a termination of pregnancy, they say in relation to a pregnant woman, okay? It means a medical procedure. Now they also put down, they define what medical means, so, because that, it's open to the conjecture that, abortion is healthcare, it's a medical procedure. Well, no, they mean medical, that it can only be done by people with medical licence, and it involves either giving drugs or some sort of surgical procedure. So that's what they clearly define what is meant by medical. They also define what's meant by fetus, because they say, well, the fetus only becomes a fetus at around 8 weeks when the organs are starting to form. Before that's an embryo. So they say, well, that also includes embryo. So they cover the whole gamut, and there's other definitions as to what exactly means. But what I like about it is that it's intended to end the life of a fetus. So that's honest. We don't like it, but at least it's not just saying it's a way of terminating a pregnancy. So they say that. So they start off with that phrase that it's a termination of pregnancy, but in this context, it's intended to end a human life. I mentioned earlier that the doctors and to some extent other healthcare workers, although lesser than doctors I think, are protected to some extent by the wording of the Abortion Act from 1967. So this is pretty strong, and this has given us good protection, and some people don't like it and they would like it this was removed. And if abortion is decriminalised, which could happen, abortion is still a criminal offence, by the way. Some of you may not realise that. I did a survey in my own hospital a few years ago where I asked people, do you believe abortion should be? I just wrote a simple question because I knew a lot of them wouldn't really know what I was talking about. Do you believe, in your opinion, should abortion be decriminalised? And the vast majority, I got 112 responses, and I was all face to face. The vast majority said, but it is decriminalised, it's allowed. But they don't realise it's still actually a criminal offence. But it can be carried out if, according to the features within the Abortion Act, if they're followed as they're meant to be rigidly by law. So it can be done if two doctors agree, they sign the form. It's done under A, B, C, D, E for a specific reason. But if it's done outside of those reasons, so for example, if a woman has an abortion at 28 weeks, self-induced or induced by someone else, it's against the law, and she could be prosecuted for that. And there have been a small number of cases where that has happened. So it is a criminal offence, but if abortion becomes decriminalised, then this protection clause may not apply to doctors or to other healthcare professionals in this country. And that is a real worry for us, so we're determined to fight that, because you can guarantee at some stage in the next 1 to 2 years there will be introduced in Parliament a decriminalisation bill for abortion. It has been attempted before, but it never got to the stage of debate, I think. So according to the Abortion Act, no person shall be under any duty, whether by contract, or by any statutory or other legal requirement, to participate in any treatment authorised by this Act. Now, in those days, there was no such thing as chemical abortions, it was all surgical type abortions, but it does apply to chemical abortions as well, to which he has a conscientious objection. So it specifically recognises the right of healthcare professionals, and in this case it would be particularly doctors, because when this was challenged, so Janaway in Salford, she tried to use this phrase, say, well, I'm a healthcare worker, I work for a GP surgery, I don't want to be involved, I've got a conscience too. And I said, well, you're not hands-on, sorry. Similarly, the Glasgow midwives say, yes, you don't have to do the abortion, but you must supervise other nurses who are prepared to do it, and prepare rotas and be supportive to them. This came from I mentioned about the reasonable accommodation. Lady Hale, who was at that time the Vice President, I think, of the Supreme Court, and then became the President later on. And they recommended that reasonable accommodation should have taken place, that employers have a duty to look after their employees, even if they may not like their position on anything, but they do have some authority over them, and they can, override some of their conscience decisions. This is the General Medical Council. Again, this is part of the protection that doctors have. So that's why I'm encouraging you, don't be afraid. Don't be afraid to go into medicine if you're afraid. Don't want to go into that. There's too many ethical things that might get into trouble. So we are protected. So the GMC recognises that we have personal beliefs. But we're not allowed to impose them on others. But it doesn't mean that we're not allowed to maintain those beliefs. We just have to be careful. We have to be respectful. We have to accept that other people may not agree with our stances, but we don't necessarily have to participate in procedures that go against our conscience or our moral judgment. So we may act according to our beliefs, but these are the key things. We must not treat patients unfairly. And we must not deny patients, so we must not prevent them. So we can't stand in front of an abortion clinic and bar the door and stop them from going in, or we can't lie to them. We can't tell them, oh no, you can't, because there's no place in this city where you can get an abortion. So you can't tell them lies. You can't obstruct them deliberately, and you mustn't cause them distress. And that's open to debate, because one man's distress is another man's joy. Maybe I made that one up myself. Well, what is distress? I had a confrontation with a patient. I felt quite distressed about it, but yeah, she probably felt distressed. It had nothing to do with abortion, but there's other issues about demanding tests that I didn't think were appropriate or reasonable. So patients can cause us distress just as much as we can cause them distress. So you have to be a little bit respectful and not lose your temper. Don't swear at patients. Don't shout at. Don't hit them with a punch or kick them or headbutt them. Even in Glasgow, you're not allowed to headbutt patients. I believe. I may be wrong on that. That might be standard care. So this is important. So we can choose to opt out, but we have to do so in a respectful way. We're not allowed to harass, or we can't enforce our beliefs on other people. We have to say sorry. Someone says, "Doctor, I'm pregnant. I don't want to be pregnant. I want you to refer me for an abortion. I want you to do an abortion. I want you to provide the abortion pills." So I'm sorry, I can't. In fact, we don't necessarily have to explain. In my case, I would. I think a patient deserves an explanation in a non-judgmental way. I wouldn't judge, and we can't be judgmental in any case. So many of the women who contacted me, for example, looking for abortion pill reversal, not all of them went ahead with the treatment. In fact, 35% for various reasons, usually due to coercion from other people, but some of them voluntarily just wanted to know, if I get involved, what will I have to do? And I was offering them progesterone that I would arrange for them, but not all of them went ahead with it. And I had to respect that. I didn't say, "Oh, you're a terrible woman. You're going to go to hell," or "You do not realise what you're doing to your child." So I said, I would always leave the door open. If you change your mind at any stage, and even if it's after the miscarriage has happened. So I usually use the word miscarriage in that context, because that's what the abortion pills do. They induce miscarriage and cause abortion. So even if you want to talk to me afterwards, and some of them have come back, and some have asked me to refer them to people like Arch and Rachel's Vineyard, and who've looked for help because they realised that when it was too late, what had happened. So we can't be judgmental. We have to be respectful. We have to be kind to people at all times. I'll make my political point. This is my favourite point to make in any of these talks that I give. The pro-life movement. And SPUC is a major part of the pro-life movement, as are abortion resistance and Rachel's Vineyard. And I'm not sure I can't see the other ones from here, but I've got an abortion resistance badge on here, so a little plug for abortion resistance. So please talk to them over the weekend. The pro-life movement is based on three things, three pillars, three very, very dependable, strong pillars of truth. So we're always honest. We do not lie. We do not tell mistruths. We do not give misleading information, even though we are often accused of it by the other side. But it's based entirely on truth. It's based on courage. The other side, they want us to be afraid. They want us, and they think we are afraid. Well, they're starting to learn that maybe we're not as afraid as they thought we were. Because for a long time, especially in the UK, they've had it easy. 95-97% of the UK population, we're led to believe, are pro-choice. That may be, it may not be, we don't know. No one has ever done a full survey on it. But certainly they've been working on the premise that nobody in this country really cares about abortion. Well, that's starting to change, and you're going to be a major part of that. So it's based on courage. Do not let them instill fear into you. Don't let them... It was, well, I don't want to be harping on too much, but it was probably never more manifest in the case that I had, where the people who took the Mary Stopes International and the RCOG, they're the ones who took the abortion pill reversal case against me and reported me and Dr Riley to the GMC for what they consider to be professional misconduct. But as turned out, and as Louisa mentioned, when the GMC looked into it, the word they used was there was no prospect of finding any evidence to support the allegations. Now, it took them 9 months to reach that, and it was only the threat of the High Court, because it was me who took them to the High Court with the aid of Christian Legal Centre. So we were 6 days away from going to the High Court, and the GMC suddenly dropped it, having done nothing for the previous 9 months. And I've no doubt that the reason they dropped it is because they've no evidence, because you can't go to the High Court and present allegations against a person, and then the judge is going to, at some stage, is going to say, okay, now can you present your evidence? And if your only answer is, well, we don't have any evidence, Your Honour, but we don't like what that guy's doing, you don't really have a strong case. And I think that the GMC, they must have realised that was going to be the likely outcome if they had gone to the High Court with us. So they dropped the charges. Interestingly, it took another 6 to 8 weeks before they dropped the charges against Dr Riley, because she didn't take them to the High Court. She went on a different way with a secular medical protection group who basically told her to keep your head down, don't challenge this, you might make it worse. Whereas I was defended by the Christian Legal Centre, who the very first day, 2 days after the charges were brought against us, we had a meeting, and Andrea Williams, their CEO, it was a Zoom meeting because it was during the COVID time. She pointed down the camera at me. I didn't even know who she was, and she said, no, we are not going to accept this. This is unjust. We are going to fight this, and we are going to win. And I thought, okay, well, because I thought, well, the GMC, nobody can beat the GMC. You're brought up against the GMC. It's a death sentence. You've lost from day one. But she said, no, we're not going to accept this. And she, as it turned out, she was right. She had a very, very clever legal team who had a very, very strong and clever, well worked out strategy. Okay, so we can't stop people doing things that we don't think are good for them. We can't stop them from doing things that we think are immoral or wrong. We can decline to participate or facilitate those procedures or interventions, but we can't stop them, and we mustn't try to do so. Similarly, if a patient, for example, and I've come across a small number, a handful of patients who have had some sort of gender identity crisis and identify as a different sex from their true biological sex. And they've come with other problems, pneumonia or heart conditions or whatever. So we still treat them. We don't, the fact that they are trans or transgender or have a different way of looking on gender identity than I would or anyone else would, doesn't mean that they're not human beings. So these are human beings probably hurting a lot who are in need of medical support, and they need help. Not necessarily for the various pathway that they followed in their gender situation, but they need help. So we cannot deny, we should not deny. In fact, if anything, we should give them more love and attention and be there for them if they need it. So that goes without saying. Similarly, any woman who's had an abortion or anyone who's using contraception or anyone who's had IVF, we do not discriminate against them because we disagree with whatever value judgment they may have had at some stage in their life, either in the past or in the recent past or even in the present. We still meet their other legitimate medical needs as best we can. And the other important point is, and one of my colleagues, the current president of the Catholic Medical Association, a wonderful guy called Mike Delaney, who's just retired as a GP. When he was a GP, he came across some situations where he wasn't quite sure, and he wasn't quite sure about the GMC's situation. So we actually wrote to the GMC for clarification, and they gave him back a very, very helpful and supportive response. So in particular, he brought up the idea of Viagra. So if he was happy to prescribe Viagra to a married man, in a loving marital sexual relationship, he wasn't so keen on giving it to an unmarried person who might be going to abuse women or go out on the town or go on the continent or go to Bangkok or something, to have a nice... nobody going to Bangkok, I hope. Hope I haven't offended anyone. I don't want to offend anyone. So he wrote to them and said, so what should I do? Because I'm happy to give it to one group of people, but I'm not happy to give it to the other group of people. And the same applies to contraception. So this doesn't affect Catholics as much as maybe some other non-Catholic Christians who might feel that contraception is actually okay in the married context, but not outside of marriage. They're in a real bind here, because the GMC response, I think appropriately, is that you must not discriminate against the patient on the basis of their marital status or other features. So if you're not going to give Viagra, then you don't give it to anyone. So you don't give it to married men if you're not prepared to give it to single men or men in other types of relationships. Similarly, with hormonal contraception or contraception that has to be prescribed, if you're not prepared to give it to an unmarried woman or couple, then you shouldn't be giving it to a married. You must be consistent. So consistency is a reasonable approach, I think, and I think most of us would respect that, even those who would like to maybe help people in their needs if they want Viagra or other medications that we would like to give them, but we can't because we need to be consistent. And that's an important concept, I think. So basically what's appropriately protected is our option of declining to take part in things that go against our conscience or go against our moral beliefs, our religious beliefs, but not always necessarily religious, because there are some non-religious secular healthcare professionals who would hold very, very similar views to ourselves on many of these life-type issues. So basically we're protected from participating in areas that go against or contrary to our conscience. So, what's not protected? This is afraid now. You don't have to be religious to get this. I think stupid for Jesus is still stupid. An American guy that I met last year, he used that phrase, and what he meant was that you have to be clever. You have to be wise. You can't just rush in and do things because you think, oh, this is what Jesus would want me to do, or whatever. So we have to be, we can, and it can happen to any of us. We can do things that really we shouldn't be doing. I'll give some extreme examples maybe, but for example, if we're claiming a conscience protection, and the religion one is a good one because that is protected by the characteristics, the protected characteristics. So if, for example, someone tries to say, as they often do, that you have to participate in abortion, you say, well, I can't. I'm a devout Roman Catholic. I cannot participate in abortion. Or I'm a devout Muslim. I cannot participate in abortion. And they have to respect that because they're breaking the law if they don't. If, on the other hand, you try to say, well, I've got a personal belief. I'm not going to be involved in doing any appendix operations. I'm not doing appendectomy because I believe the appendix, the human soul is in the appendix, and by taking it out, we're destroying the integrity of the person. Now, nobody in the Catholic Church, that's not in the Catechism. I don't think maybe there are some people who believe that, but so if you come up with some wacky or strange or unsupported statements then you're treading on very, very dangerous waters. So you're not allowed to do those. You're not allowed to have your own personal little quips that you would like everybody else to support, but actually they don't. So just be careful on those type of I don't think anyone would use that, but it could happen maybe in less extreme type of situations. Similarly, we're not at work to proselytize. We're not there to convert people. We would like to, but it's not our job. I'm employed in the NHS to work as a cardiologist and a physician, and that's my job. And I cannot go around telling people on my ward or in my clinics that you must convert to Catholicism or you must stop doing abortions or you must. Now, if I'm asked, if someone says, what's your opinion on it, then I'm entitled to give it. Someone is asking me my opinion, whether it be a patient or a colleague and so on. And also I mentioned I did a little survey, and you're allowed respectfully to do surveys if you do so in a non-judgmental way, because doctors love surveys. They love being asked simple questions. They don't like complicated things, but if they can sort of write just a 2-word response or a 3-word response, they love that sort of thing. Medical students love it, and probably other people do as well, but nothing very complicated. So you're allowed to do certain things, so we can sort of push the boundaries to some extent, but you've got to be very careful. You've got to be wise. You've got to be sensitive. You've got to be strong, I suppose courageous to some extent as well. There are lots of organisations that was affected. The Catholic Medical Association has been very helpful to myself. When I was the president, we got a number of calls. Every year we'd get maybe a handful, 4 or 5 calls from people working in, not necessarily members of the CMA, but usually Catholics, but sometimes non-Catholics. And I got some feedback particularly from Muslim colleagues, thanking me for the advice that I was able to give them. But in a few situations, we had one nurse in Scotland, I won't mention the town, but in one of the Scottish cities, who was being pressurised to participate in abortion. She had been involved in a different aspect of surgery, but now her hospital was some change in policy, and now they were doing abortions in her that had never been done there before, and she was being asked to participate, and as a trained surgical nurse, she was expected that she would participate, but she objected to it. And they were trying to put her under pressure to do it or else to lose her job. So she turned to us. I just wrote a very simple letter. I just quoted the catechism. I quoted that this is the official church teaching. She's a practicing Catholic. It's her religious right or her conscientious belief based on her religion. And the issue was settled. Maybe not exactly 100% as she would have liked, but it was settled. So the reasonable accommodation took place. Similarly, I had one from a young medical student in one of the universities in the Midlands area, who was being pressurised. She just made a statement one day to one of her supervisors in general practice that when I qualify, I wouldn't be prepared to prescribe hormonal contraception. The GP supervisor should have taken it as an opportunity to talk to her, explain her position, but no. She decided she was going to report her. You can't have doctors like that in this country. So she reported her to the Dean of Medicine, and there was a case taken against her. And again, they were threatening to throw her out of the medical school. So she turned to the CMA, and just by a simple letter quoting that this is, such an important issue for Catholics, and again just quoting the catechism, the official church line, the official church teaching. Again, she was reinstated without any repercussions. I think so. So it is possible that these sort of interventions, just respectfully done, but truthfully done, providing truth and courageously, we can stand up to these people who would try to walk all over us if they could. Christian Medical Fellowship, I'm not as familiar with, but I know that they provide excellent support to their members. Just in recent weeks, a new organisation has been formed called the Association of Pro-Life Doctors, and at the bottom one, that's the American Association of Pro-Life Obstetricians and Gynecologists, is a wonderful, probably even though I'm a member of the CMA, the APLOG is my favourite organisation in the world, I think, in terms of its stance, its articulation, the members, how articulate they are, how intelligent they are, their timing when they intervene in certain debates, their resources, their educational resources, is just wonderful. Their conferences, I'm blessed to be going to the conference next week. I'll be attending that for the 4th time. But it's such a wonderful occasion. We're trying to emulate that. Now, we're a long, long way from APLOG. That's why I said at the start, we would love to have more obstetric, pro-life obstetric people in this country. Pro-life midwives, pro-life nurses, pro-life general doctors. Because we need the numbers basically to have any sort of credibility. So if we say, well, we've got 10 members and up against 3,000 in the Royal College of Obstetricians, we don't have much credibility or clout. Whereas if we say, well, we've got 1,000 members, all who are strongly pro-life in their beliefs, but still practicing excellent medicine in wide areas of specialities, that's a pretty strong statement. SPUC, of course, John mentioned that they do some legal cases. They help people in legal situations. In my own case, the Christian Legal Centre got involved right from the start. Alliance Defending Freedom, many of you will have heard of them, and they they deal particularly specifically with conscience issues, and they're very, very good on that. Many of you are aware of these censorship zones that Isabel and Adam Smith Connor, and now the latest one with Rose Doherty in Scotland. ADF have been very much at the forefront in defending these people. There is, again, this is not just for medicine, but a recent formation of a national Christian trade union is in the very early stages of being born. Now, this is very important because there are many situations where Christians in particular are taken by not only in healthcare, but by their employers because they don't like the wearing a cross or their stance on some issue, and they get sacked. And then they're a member of a union, maybe Unison or Unite or some of these secular unions, and they go, and these unions have to support them, they have to go through the motions, but they don't do so enthusiastically, and they're not very sympathetic to the view of their so they'll basically say, okay, we'll sit at the tribunal or the disciplinary hearing with you, but we won't agree with what you say, but we'll just be there to witness on your behalf to make sure you get a fair deal. But they don't do so with any enthusiasm. So this is recognised by Christian Concern initially, actually, who realise we need something stronger. Our Christians who are being taken to tribunals and disciplinary hearings need stronger support from people who really, really care about these issues and who really, really care about them. So we're in the process of forming a national Christian trade union, which has full trade union recognition. So it's a fully on upboard, legitimate trade union. Thomas More Legal Centre, I'm not sure how much they're involved. In the past, I know the Glasgow Midwives, Neil Addison, who was their chairman at the time, was very, very outspoken at the time on a number of other cases. But he's retired. I'm not sure how much work that they're doing since then. Anyone know who this is? Alex would know, but I'm not. This is one. He's an Englishman. Well, he's deceased. He died during the COVID years. Robert Wally was Dr. Robert Wally. He was a trainee obstetrician gynecologist in the Bristol area. I think he qualified in Birmingham, but he was training in Bristol in the southwest of England around 1970-71, shortly after the Abortion Act had come in. Now, he was a devout Catholic who didn't want to participate in abortion, but at the time, pressure was being put on all trainees that they must participate, otherwise they would be struck off the courses. They would not be allowed to progress in their careers. So he was basically told, well, you've got three options. You can do the bloody abortion, that's the way it was phrased, do the bloody abortion, or you can take on another specialty. Now, he'd already done 5 or 6 years of specialised training, so he didn't want to go back and have to do something as mundane as cardiology or dermatology or something. Or you could leave the country. So he left the country. He went to Newfoundland in Canada, to a lovely little town called St. John's, and he set up a very nice practice. But taking on board Pope John Paul II, a wonderful encyclical, Evangelium Vitae, the Gospel of Life, Rob Body, having read that thoroughly inside out, said we have to set up an organisation that fulfills what's contained in this encyclical. So we set up a great organisation called Mater Care International, who are doing tremendous work, particularly in developing countries, where they take Western standard medicine, and particularly obstetric maternity medicine, they take it to the middle of Kenya. The first project was right in the middle of Kenya, a little town called Isiolo, which had a high maternal mortality rate. They set up a hospital, they trained all the staff, they had blood transfusions, they got motorcycles and ambulances, and it took a lot of fundraising, of course, to this, but they built a hospital from scratch, and it's still running. And in the first year, they had over 3,000 births, and not a single mother died. Now, for Africa, rural Africa, that is astounding. But that's the sort of work, and now they've moved into, I think, Uganda and one or two other of the Central African countries. So they're doing tremendous work, as are other. It's not only Maricare, but they're the ones that I'm familiar with, and they run a wonderful pro-life conference in Rome every 2 years called the Maricare Rome Conference, and anybody can attend. It's right next door to St. Peter's, wonderful rooftop views. A great conference. They always have very, very good speakers, including Alex Schadenberg, who's been over a few times. We've had lots of little victories. I've mentioned one or two of them already. Julia's not here, is she? No. Julia Rinkiewicz. She's my hero. I would love to meet her. I've never met Julia. She was a nursing or a midwife student in Nottingham. She was president of the pro-life students group, I think, in Nottingham, and they tried to. In fact, they successfully got her off the course that because of her pro-life stance, she could not become a midwife. But she challenged it, I think, with ADF's assistance, and she won. And I don't know what compensation, but I don't know if she's fully qualified yet. But she is a true courageous hero of the pro-life movement, and she won her case. Arthur is a Catholic from Malaysia who is a dedicated obstetrician. He's training still. He's not fully completed his training, but once again, because of his opposition, particularly to contraception, they tried to say, oh, well, you haven't fulfilled all the criteria for the curriculum, so you can't be allowed to progress in your career. And he challenged that, and again, with the aid of ADF, he was able to show that while he didn't use hormonal treatments for contraceptive purposes, he used exactly the same treatment for non-contraceptive reasons, because women have other gynecology needs that these treatments are also used for. Similarly, with IUD, said, well, you haven't inserted an IUD for contraceptive. He said, that's true, I haven't, but I've inserted IUDs for non-contraceptive purposes, which they are sometimes legitimately used. So just by being courageous and standing up to these people who they thought that he would just bowl over and accept the penalty and leave. He's still training now. Luckily, he's been moved to a different region where he is getting a lot more support and sympathy from what he had before. I joined the Catholic Medical Association in 2008, and I did so, I'll finish up now in just a moment, I did so on the basis of a case that I'd heard about. I didn't know who the girl was, but she had trained in Poland as a medical student, and then as soon as she completed her training, she came to Scotland, and she did her first 2 years, foundation years in Scotland, either Glasgow or Edinburgh, I'm not sure which, and I was very happy there. But then she wanted to become a family doctor, a GP, and she got accepted onto one of the GP training programs. In her very first position, her very first weekend, because she was doing obstetrics, because they have to do a certain amount of obstetrics and other general medical areas before they can move into general practice. So her very first job in the GP program was in obstetrics, and she was on call the first weekend. And it was a Sunday evening, and the nurses said to her, would you mind prescribing the medications for that young girl who's having the termination in the morning? And she said, no, I can't do that. I'm a Catholic. I can't be involved in this type of intervention. The nurses were absolutely astounded. They had never, ever come across anyone declining to do that type of job before. And then they thought, well, maybe she's Polish, maybe she doesn't understand. So, no, you don't have to give the medication. We'll give the medication. You just have to write it. And she said, no, I can't do that. That would be me being involved, being complicit in helping a woman to have an abortion. I can't do that. And they had a little huddle. They just didn't know what to do. So they said, well, the only option, it's a Sunday evening, we don't like doing it, but we're going to have to call in the consultant. And he won't like it either, and he might give you a rough time. But still she held firm, and they did. And he came in, and he roared at her on the ward in front of patients and nurses. People like you should not be allowed to work in this country. And she was in tears, but she stood firm. That was Sunday. 3 days later, Wednesday, he called her into the office and he apologised to her because he had broken the law. He should have been sacked, or he could have been sacked, or at least reprimanded for what he had said to her, trying to put her under that type of pressure to go against her conscience, because she had every right by law and by GMC standards to take the stance that she did, and they had no right to try and persuade her to do otherwise. And when I heard that story, I didn't know anything about the Catholic Medical Association at the time, and I thought, and then she told me herself, so I got it firsthand. I knew exactly what had happened. That very same day, I went to my computer and I typed in Catholic Doctors Association, and eventually I got the CMA. And that was the reason I joined, because I said there must be some organisation in this country that supports young doctors like that. I didn't mind. I was a consultant. I was still a junior consultant at the time, but I had a reasonable amount of protection, or at least I thought I would have had. But this was a young girl, didn't know anybody probably in the hospital, certainly didn't know if there were any Catholics and anybody that might support her moral stance, and yet she was courageous enough to do that. And I said there must be some organisation, and thank God I found what I was looking for. The final one is we're also protected, even though with Brexit I'm not sure how much this applies anymore, but we're protected even within Europe. An attempt was made in 2010 by a British Labour, I think, politician who was a member of the Council of Europe at the time, McCafferty, to try and certainly downgrade and, if possible, abolish conscientious rights for doctors in Europe, because it was recognised that there were many parts of Austria and Italy where abortion was allowed, but there were just no doctors prepared to do it. Even in Ireland, Ireland was only had a few years, but it's a GP-run service because it's mostly chemical abortions and it's mostly administered by GPs. 90% of GPs do not want to be involved in abortion, so it's a small percentage. Even obstetricians in America, 85% of them are not involved with abortion. That's possibly why APLOG is so strong, because a lot of them do not want to have anything to do with it, because they recognise they know what it is. But anyway, this attempt was made, and she put forward the bill to the European. It wasn't the Court of Justice; it was the Council of Europe, which doesn't have any legal binding, but it is a very powerful, influential body. With the help of two people, Ronan Mullen from Ireland and Luca Volante from Italy, they introduced 29 amendments to the bill. And it turned out when it was voted on, it actually coffer-fastened and strengthened more than ever the right to conscientious objection in Europe for doctors. So that was another little victory. And that hasn't been changed since then. Now, there are still efforts going on in Europe and elsewhere to try and to try and at least reduce the rights of doctors and other healthcare professionals to object on conscience grounds. Take-home message: don't be afraid. Don't be afraid. Have courage. As I mentioned, our foundation, our movement is built on three. I forgot to mention the third one. So it's truth, courage, and love. Everything we do, we have to do it in love. We know that a lot of the people that are opposed to us, that the pro-abortion is built on the exact opposite. It's built on lies, attempts to instill fear and hatred of the truth, hatred of beauty. But we know a lot of these people are hurting. They're hurting badly. A lot of them have had experiences themselves that maybe they haven't come to recognise or fully acknowledge. But we have to do so always with honesty, courage, and with love. Thank you very much.